Welcome to Bite Size Dental Marketing. Today I have Santosh Patel from Complete Specialty Solutions. Santosh, man, I love your company. I love the concept, and specifically, there's a couple offices that you work with that we do, and we have together, and they love it because your guys will come in, your docs will come in, they bring the stuff, they set up, and a lot of times the doctor's not even there and has sometimes the best day they had that week
Right.
in in income. And I love, I love the concept because to me, it's about helping the, bread and butter general dentists that I think are kind of the lifeblood of the industry. And so I'd love to hear the origin story of how you got started.
Yeah, absolutely. Well, first of all, thank you so much, Eric, for having me on. I'm humbled just by your comments on how our practices feel. I would say still kind of to our core, we're more focused on the patient experience side, which is odd enough
Hmm.
because we don't actually own the practice, right?
Hmm.
But so my background, I went through college, kind of went through variations of different, employment histories, and eventually got into the healthcare arena and went and moved to Houston, got my master's in healthcare administration. I ended up working for one of the largest health systems in the nation on physician practice growth, and had great mentors and leaders, and was able to be successful and kind of progressing through my career there. And I eventually got to really a COO role where I was managing over 300 physicians and building multi-specialty physician groups. And that was kind of the vision of just, hardcore operations and execution operations. And eventually there's some M&A. But, my wife's a general dentist, and we owned a practice in Houston. And, essentially kind of the story was she pulled me in on a Saturday to help her with an emergency patient. I'm over there trying to figure out how to suction, and she's yelling at me to think physics, and so I don't know what that means, but ultimately she tells the patient, she gives them some antibiotics, writes some pain meds, and was telling the patient, like, you're going to have to set up some time to speak with an oral surgeon, and I'll send a referral. And as I'm sitting there chair side, the very first thing the patient says was, well, why can't I do that here? And as we're driving back home, I said, well, why can't you do that, in the practice? She says, well, I'm not an oral surgeon, and that's an extraction that is out of my kind of scope and comfort level. And from a patient experience standpoint, it's better for the surgeon to do that. They can do it really quick versus it could take longer. And if I did it, and I said, well, no, I get that, but why not just have the surgeon come to your office, right? In the medical world, I was doing that. I was bringing cardiologists in, orthopedics in, neurology into the one central hub of family practice and primary care, because patient compliance would go up. Patients didn't want to go elsewhere. And so,
Right.
when she told me, oh, that's, some of the larger dental groups and DSOs do it, she goes, it's almost impossible for small groups and solo practice. So it started triggering, the thought process on, why is that the case? And so spent some more time going through LinkedIn, finding specialists, just cold blasting messages out to them, say, hey, just trying to do some research. Would you be open to a 15-minute call? And as I learned more and more about it, yeah, specialists hated traveling. They just absolutely hated the concept of packing up stuff, going somewhere where they didn't know who they're going to see, why they're going to see
Hmm.
them.
Hmm.
Um, and I realized it was really the level of operational support that was needed, and just
Hmm.
true transparency. So a buddy of mine, had a healthcare tech company, and I stayed in contact with him, and we started brainstorming ideas together. We pulled a couple of our other colleagues and friends together. So we started the company 5 years back. So I left the medical world, jumped straight into dental, knowing nothing about dental, other than how I was helping my wife. She was kind of managing her practice. It's been a journey. Really kind of with that same core focus of, well, we know consumers, regardless of the industry, consumers want convenience. And if that's shopping at Super Target, Costco, Amazon, right? They want convenience, and they want it to be, somewhat at the same kind of affordable measures as possible. So our vision was, well, how do we do that for solo practices and small groups? And really, that was kind of our core focus. And then we ended up also serving kind of large DSOs as well, just by nature of the model that we have. But we wanted to operationalize the traveling specialty. We didn't want to be the staffing company that just introduced you to the specialist and walked away. we wanted to
Mhm.
have the technology in place that really streamlined the workflow, made it seamless, and just integrated and really kind of enhanced that patient experience. And so, you mentioned we have some shared clients, and sometimes those are really productive days, and many times they're not even at the office. And that's
Mhm.
that's
Mhm.
extremely humbling for us, right? Because we're there, we're bringing value to their practice. They trust us enough to open their doors and let us work within their homes and take care of their patients. And so it's been a good journey of how we started, and excited for our continued progress.
Yeah, whenever we talk to prospective clients about it that we have, and because there hits a point where they just can't, they're already working 4.5 days,
Right.
they're seeing 40 whatever new patients a month, they their schedule is full, right? um and we see this as a way to increase production. But so walk me through the patient experience. So I go in, I see my dentist, that she says, I need an extraction,
Hmm.
and there's a specialist coming in, 2 Tuesdays from now.
Yeah.
Walk me through then kind of what happens operationally
Sure.
with complete specialty solutions.
Yeah, and honestly, it kind of even starts before that, right? So it starts actually with the marketing element. So, previously a general dentist who maybe did not place implants, just didn't market implants, but it's a great procedure to market. But by now having the service in their office, they can now actually market that as a service. And so a
Yeah.
patient arrives to the practice, the general dentist assesses the patient, completes their exam, and then really comes up with a comprehensive treatment plan, not just would be nice to do or needs to do, but a comprehensive plan of everything for that patient, and goes through a detailed. And so I know a lot of folks get excited about a case acceptance of 90%, right? Well, the best, some of the best baseball players are batting 400, and that's because they swing, right? And so,
Hmm.
build that comprehensive, treatment plan, and be confident in the plan. But they, educate the patient on the need of the treatment, and the importance and the urgency around it. And then they say, we actually have, for the convenience for our patients, we actually have Dr. Joe Smith, our oral surgeon, that comes to the practice, a couple times a month. What we're going to do is we're going to send your information over to Dr. Joe Smith and make sure that they can look at your x-rays, your medical history, and we're going to get you tentatively scheduled for the day that he's here. We'll get you down for 11 o'clock. But then we'll call you back to go over your full treatment plan after we've been able to assess everything.
Hmm.
And so, typically that journey takes about 24 or 48 hours. That referral is submitted through a software that we've developed on our own, with the help of actually 5 front desk employees who said, please don't add more to this, just keep it really simple. So thankfully
Yeah.
our adoption rate is great. And to submit the referral, then we have a team behind the scenes that completes the insurance verification. We have a team of coders that work with the doctors. And then we have our team that actually calls the patients to go over the treatment and present it to them, provide some financing options for them. And everything is really billed through the practice.
Hmm.
If there's any pre-op needed for, let's say because we offer IV sedation. And so if we're coming into the practice, we've already, we have our supplies, equipment, everything that meets the state requirements. We have DEA, everything's kind of signed up, appropriate, compliant. We call the patients, we go over pre-op instructions. If there's any medical clearances needed, we gather that information with our team. And then we're there on the day of. So we wheel in with all of our equipment, all the way down to gauze, right? So we bring our own gauze
Hmm. Hmm.
simply because we know exactly what our surgeons are going to want. And so we provide all that information. We provide consent forms, all the documentation's ours. We bring our assistants, our surgeons, our instruments or supplies, and we also provide a front desk employee that comes in to really help navigate and be that air traffic controller for that day for specialty. And then we render care, take care of great patients, and wrap up and head out. And we typically do one location a day per team, and we'll have 2 or 3 teams per market going at the same time.
No, I've seen him show up in the morning. It's quite impressive
Yeah.
to see him come in and get set up. And I'll tell you, for me, I like the comfort and the relationship that's built, even though they may only be there once a month or
Hmm.
once every 2 weeks. I like that they build the relationship with, not just the doctor to doctor, but the entire staff gets
Right.
involved. Yeah. Yeah. No, I've always been impressed. Yeah. Now, I know it doesn't happen often, but I do want to ask, like, what happens if there's a problem with the work, or what happens
Yeah,
if the patient wasn't compliant? Any number of
sure.
reasons that things go bad. How do you sort of navigate that between the two companies?
So the first part is, I mean, that's why we want the information in advance, right? Well, that's why we want to leverage our technology so we have access to the X-rays, because we want to determine if the case is appropriate for that setting, that environment, right? So we go with the mantra of right case, right place. Is this an appropriate case, or is it a case that's going to require a lot of follow up and frequency of visits?
Mhm.
If that's the case, and we're only there once a month, it's best to probably refer that case out for the patient experience standpoint, right? But if something happens, let's say after some wisdom teeth extraction, patient still has some pain, maybe a few days after. All the patients have the phone number of our specialist. They get contact information through our tech platform as well. But then we stay engaged with the practice if the patient ends up calling the practice, or ends up just showing up at the practice.
When I got into dental marketing, almost a decade ago now, almost no general dentist did a lot of endo. Invisalign was around, but not as big as it is today, so there's not the big ortho push.
Mhm.
More and more dentists now are doing all on fours,
Right,
general dentists than ever. How do you see the industry shifting as general dentists take on more, what used to be classically specialist things, and as technology, brought to bear, there's more cone beams in general dentist
right.
office now, where things like that. How do you see the industry trending in that regard?
It should. I mean, obviously, if the general dentists want to continue to gain their skill sets and training, and they can determine case selection. I mean, I'm not a clinician, right? But I see it,
Mhm.
and there's some great general dentists doing specialty work. Um, we're not seeing that as the common. I think what ends up happening is private practice owners, small group owners, they tend to feel the pressure of having to complete these treatments, even though it's outside of
Mhm.
their comfort zone, because they don't have an option for the patient, right? They want to be a comprehensive solution. They don't want to refer them out because there's no certainty that the patient's going to come back. So they feel somewhat forced to having to provide that level of care, and so that's what we found as we were coming in. We'll come into a practice, we'll do an opportunity assessment, and we realize, okay, well, we already see that you're placing X number of implants. I don't know if there's enough opportunity for a specialist. And they're like, no, trust me, there's plenty of opportunity. I actually take 2 to 3 times longer placing an implant than you would place an implant. And
Mhm.
I
Mhm.
have enough operatories where you can continue to work at the same time that I'm working and driving in new patients, seeing new exams, driving up our practice opportunities as well, and then working in collaboration for that. And so, I think you're always going to have, dentists who want to learn. They're eager to learn, and again, rightfully so. I think it's important that they continue to enhance their skill set and competencies, but there's enough opportunity out there. I mean, I think less
Yeah.
than what 30% of 35% of patients actually end up going to the dentist, right? So the 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 challenge is not how do we get more market share of implants. The true question is how do we get more patients to go see the dentist, right?
Right.
And so that is what really, as an industry, everyone needs to kind of stay hyper focused on.
Similarly, we don't look at other agencies as competition. I think I'm in competition with education, and
Right?
I'm in competition with insurance companies. I'm in competition with many other things.
Yeah.
But marketing is not really one. Now, you kind of touched on it briefly. What is an ideal client from a physical space? Because obviously,
Sure.
if I'm a dentist and I'm working, we can't be working at the same chair. And from a physical space, from a production, from a number of procedures they do, what do you kind of see as an ideal client to
Yeah.
partner with?
From a a facility standpoint, we'll come in and look at the room. I mean, ideally, we're at least looking at some space that has some elbow room for our surgeons to come in, the anesthesia monitors and equipment. But we typically would only need 2 operatories. If it's a really busy day, we're using 3 operatories. And for surgery, we typically are there in the morning. We're kind of out by 1 to 2 o'clock. We can really see and stack the schedule pretty efficiently. And then if the general dentist wants to open up, all operatories at the end of the day, then that's an option. But We do become an operatory hog whenever we implement ortho, because at that point, at the end, when school's out, we want all chairs. But
Mhm.
really, because of what value the revenue and the patient retention brings, the offices are open to it, right? They're like, yeah, absolutely, take this day. We'll dial back some of our hours, or we'll do admin time, and you guys can have the chairs. But from a production and level opportunity, really what we look at is if you're referring out for the same type of specialty. So, if it's thirds and implants, if it's endo cases, if you're referring out at least 5 patients per month, that can help justify a specialist coming in at least once a month, right? And the reason why
Right.
I say that is once you actually start tracking and going through the system, that 5 very easily becomes 10, right? And it becomes a system, and everyone knows, and you know how to have the conversation with the patient, make sure they understand kind of the continuity of care plan. But we always want to kind of start at that level first, and that's also part of our technology piece. Is you may not know if you're ready for specialty, and part one is go ahead and start tracking in this unique platform where you can kind of see your variations of cases, and then even leverage that to help recruit if you're wanting to do it stand alone and do it yourself. Obviously we're only in Texas, but for groups that are outside of Texas, we have folks who are using just our software because it helps them track it, and then it helps them go recruit specialists for it. And
Mhm.
so, if you have at least, and you can demonstrate 5 to 10 referrals per month, healthy referrals per month, then it's enough of an opportunity to integrate within your practice setting.
Now, do you see practices start with, I'm assuming oral surgery, but I might be wrong, and then sort of add the others, or do you see them sort of their typical progression another way?
So it's either oral surgery, peri, or endo. Those are usually the three. And
Okay.
that's actually how we recommend it as well. It's just picking, again, assessing what's being referred out the most. What is the general dentist just not feel as comfortable with from a treatment standpoint? What is their age range of active patients? I mean, if they have a healthy age range of 14 to 25-year-olds, you're going to probably have a pretty healthy, wisdom teeth opportunity within the practice. So we'll target that first, build that for the first 6 months, make sure, again, it's like muscle memory. Everyone understands on the team, how is this discussed, how is this engaged. It starts with the hygienist, having that preheating conversation before they get to the general dentist. And but once we do that, then we take a step back, and again, we've already tracked all the referrals, so we can assess and say, okay, we're in here now for perio. We think endo is a good opportunity for us to start adding, right? And so then we'll launch the second specialty in the practice. We tend to wait for ortho. We will watch and track the referrals for at least 60, 90, 120 days to make sure there's a healthy number of consults for orthodontic treatment. Because once you start bracketing patients, your goal is to not really, kind of disembark the practice on short notice. You're really,
Right.
you want to be with the practice and build that practice up. And so that's one of those where you want to, be mindful of stepping in. Now, sometimes practices will call us that have already had ortho in their practice. They have active patients, and we end up being sometimes like a rescue plan where it's like, I don't know who's going to come in and see these patients. I don't have the desire for it. So what we'll do is we'll assess that and come up with a plan, and really help and kind of rebuild that program from there.
What are the typical questions you get from general dentists when you begin to talk to them?
So, you asked one of them, post-op questions, which we always love when that question comes in, because they're really interested on making sure the patient experience is there. They do want to know, the level and skill sets of the specialist, right? And so
Mhm.
before we start anything, we always get a meet and greet in place and make sure the specialist meets the office and the team. We get the green light from both sides, right? We want to make sure it's a good clinical fit, good philosophy of care kind of mindset. And so once we have the green light from both of them on that side, then we kind of look forward to schedule the next day. And then they want to know workflow. So, if it's out of network, how does that structure for the patient? A lot of patients don't really care about out of network. They care about out of pocket. and they want
Mhm,
to know how
mhm,
much is going to come out of their pocket on these treatments. And one of the benefits of being in a practice that you're already there is, your imaging there. You don't have, the technology allows us to do curbside consults, and so there's a lot of advantages for the patient on that side as well, both financially and just time, right? Not having to
mhm, mhm.
come out another appointment. But and then they want to know, it's harder when we first started because they're like, well, how long have you been doing this? I'm like, oh, 3 months, right? And so they're like, okay, this is, you're probably not going to last very long. So they want to know how long have we been doing this? How,
Mhm.
skilled are our doctors and our teams? And then they want some references. And so we're happy to share that with them. And, um, but that's, the typical question on, FAQs. And then on the finance side, we have kind of a revenue, like, again, we're seen as an associate, right? Just like they would pay an associate, they would pay our company as a fee, as a percentage, to be able to kind of pay the specialist, pay our team, and really take care of all the logistics as well. But at the end, the practices are able to retain somewhere between 30 to 40% of their production. And when we're covering all expenses, that really kind of drops back down to profit and EBITDA, which is obviously, you know,
Mhm.
vastly discussed now in the dental space.
Now, do you have an average on what a specialist will do for a practice?
Yeah, so let's just look at kind of our traditional, which is OS perio, right? And so
Mhm, mhm,
in the first 6 months, on average, they're doing right around $6,000 to $8,000 a month, right? Because they're getting in the rhythm, getting in the flow of volume and cases, and earning trust from the general dentist, the hygienist, and everybody. And so that's an average, right? So we'll have offices that do more,
Sure.
and sometimes we have offices that do less at the beginning, right? And again, I refer it to as riding a bike, right? So at the very
Mhm.
beginning, you're going to be wobbly, and that's just the way it is. But
Right.
once you get into a rhythm, you get some speed, you become steady. And after month 6 to 12 and 24, we're starting to average 12 to $15,000 on those production days.
I'll take a $3 or $4,000 day for not having to go to the office. I mean, that sounds pretty good.
Yeah, I was just actually just talking to a client, prospective client, which we already signed him up now, but he for a year he was like, no, I think we have a premium, right? Because we're a full
Sure.
service comprehensive approach. So our fee could be 65, 67% of the production. And he came back and said, well, I could do it on my own for 50-50. And I was like, okay. I was like, well, you can, if you can go find someone and recruit the teams and do all that, yes, it's possible. There's many groups and practices that are able to figure that out, right?
Mhm, mhm,
But a
mhm.
year goes by and he struggled with it, and was really struggling with knowing that he was having to refer out so many patients. And so ultimately, we worked together on this specific case, and he was like, so if I do this case in my practice, and I'm just handing the case to you, and you're doing it all on a surgical standpoint, he goes, I'll still walk away with $5,000 of profit. I was like, yeah, and we just need your operatories from 8 to noon, two
Mhm,
operatories.
mhm.
And he was like, this is just amazing. I was like, yeah, it's a I mean, it's a huge value add. The patients win because they get to stay in the place they love, right? The office wins because they generate retention and revenue, and then our teams win because we're going to the referral source.
This is my opinion, and it might be mildly unpopular, but I find dentists salted there. I mean, I think they're by and large great people. I do find them to be fairly myopic in and maybe just a little bit behind, I'll say, the trends of technology and industries and consumer demand. And I think it's a function of, for years, no dentist had to market. And
Sure.
then with the rise of private equity DSOs, they brought marketing to bear. Now suddenly
Right.
private practice had to market. Now you have almost no general dentists that don't market. And online scheduling is the next bastion. Every dentist thinks their scheduling is so unique and
Right.
personal. And in reality, like consumers are going to push you to online schedule at some point,
Yeah.
right? Because you can do it in almost every other industry. And the other one was, scheduling out. Every dentist had, the good old boy network of, this is my guy who does endo, this is my
Right.
person who does, and as a consumer, I don't want to go out
Yeah.
to other places. And in fact, I want there the big shifts in consumer behaviors are, I want a company that I can relate to and shares my values, however those are, and I want convenience.
Right.
And when you talk to dentists and they're pushing off online scheduling and they don't want someone coming into their practice and they want to hang on to these, the old past, I do find that they are going to be pushed, dragged, or led into this consumer centric,
Sure.
behavior. And because say what you will about the internet, it is the great equalizer
Oh yeah.
in knowledge. And while there's a lot of, misguided information and things like that, even though I now see specialists coming into practices, I now see online scheduling, I now see these advancements.
Right.
And, I think dentists need to get on, at least be aware of what's
Yes,
happening.
I agree. I will also give a counter argument to that, right? So coming from, my wife owning a dental practice, I mean, we're getting calls nonstop about the next solution to change your practice, right? And it's,
Yeah.
well, you should
Yeah.
do this, you should implement this, you should buy this. And it was a constant to the point where you just didn't trust anybody.
Uh-huh.
You just don't trust anybody anymore, right? And so you start to believe, well, yeah, everyone says you should do this, and you know what? Right now, nothing's broken. I'm just going to continue to stay status quo, and so I understood that perspective, and I got that perspective because I kind of lived it, right? Where everyone's like, well, your marketing team sucks, your website sucks, and I'm like, but every marketing team has told me that, and every website company has told me that, right? It's like, well,
Yep.
your imaging is terrible, and you would do this much more if you saw three more. If you saw three more patients, you would pay off your imaging. I'm like, but how is that driving in more patients, right? Right. So like you would hear that from a dental office owner perspective. You would see it, and you're like, okay, I see why the guard is up. I respect why the guard is
No
up.
doubt. Mm-hmm.
And then because I had to deal with the same thing, right? Like I'm going in these practices and I'm telling them like there's actually no cost to you. Like we're literally serving your patients in your practice, and then you cut us a check after. Like there's no upfront cost. No, I don't want to do it. Okay. And so I realized, going through that mindset is you're going to have folks who are it just takes them a little bit longer to agree to that this is, the future, right? One of the
Mm-hmm.
examples I started to use in my discussions is I respect and continue to go through your decision-making process. I'm not going to pressure you into making a decision because ultimately, if you're not happy with it, you're going to blame, us for pressuring you, right? But the example I would use is think about Blockbuster and think about Netflix, right? Blockbuster thought they had the solution. They didn't want to deviate from it. Anything that was new was too off the wall and no one would adopt to it. And
Mm-hmm.
that ultimately was their demise, right? And Netflix was constantly innovating, constantly focused on operational excellence, and always looking at their end user, which in our scenario is patients, right? But they're always looking at the end user. They're going to continue to grow and expand and take market share. And so I see it from the dental practice perspective. I try to use that as an example of you have to make some changes in the practice. Maybe not everything has to change, but you have to start making some changes. If you're not changing, then really the end is near.
No, I mean we see it in our space, and I think we're both blessed and cursed with this in the sort of internet space or the technology space that our company's in. Like the marketing we do today is, well, I would say we run Google ads, we run video ads, we run Facebook and social media. It is fundamentally different in approach than it was 3 and 4 years ago. And a good example is 4 years ago when we ran ads on social media, we wanted them to be big, bright, shiny, look like ads. I mean, like
Yeah,
flaming skulls with teeth or whatever. And now we want it to look authentic and organic, and we want it to look like just a normal post. We don't want it to look flashy or
right,
ad
right,
like.
right.
And the creative has shifted, and Google Ads used to be a disproportionately huge amount of budget, and now it's very, very minor. And so we've really adjusted it. But yeah, I mean, I think that what you're doing is needed in the market, and I think it's great.
We want to be able to build a comprehensive approach, right? And
Hmm.
to their patient base, I think it allows practices to equip their marketing teams with more, right? If you're only doing crowns and fillings, then are you really allowing your message to spread to a larger audience? And if you're not including Invisalign, if you're not including implants, you're making it that much harder on your marketing team to really kind of target really now a rifle approach of your
Right.
avatar of patient. And so it becomes incredibly difficult to be able to do that. And so we hear it all the time, like, oh yeah, we never marketed implants, but now we do. And now it's, driving in new patients that are now, part of our practice for their crowns and fillings, but also, an implant.
There's certainly the bulk of patients will just look for dentist near me, dentist in my city, dentist in my zip code, dentist in, my town, whatever it
Right.
is. You do have some very educated consumers now that are searching for higher end
Yep.
treatment of, I'm looking for all on four implants.
Yep.
All on
Yep.
X is a term that we never saw in search
Right.
terms, and now we see it. We see it. We see snap-on dentures. We're seeing a educated consumer come in,
Hmm.
and they need to be served. And but yeah, man, thank you so much for
Yeah.
taking time. I know you're busy, and I see you everywhere
Uh,
from happy hours to on podcasts to talking to all of our friends we have in common in the industry. But Santosh, thank you so much
no.
for your time, and man, I
Thank
appreciate it.
you, and Andre. I've I know we met each other probably at 3-4 years back, and I've always enjoyed the partnerships. And you guys do great work for the clients that we serve, and excited about continuing to work with you guys. So thank you so much for having me
Yeah.
on here. I appreciate it.